There is limited harnessing of technology in Nigeria's healthcare system delivery. This is according to the CEO, Private Sector Health Alliance, Dr. Muntaqa Umar-Sadiq. CNBC Africa's Onye Sunday caught up with him at the Health Innovation Challenge 2015, an innovation platform organized by the Private Sector Health Alliance of Nigeria.
So the Private Sector Health Alliance of Nigeria, led by Alhaji Aliko Dangote, Mr. Jim Ovia, Mr. Aiki Mokwede, Mr. Herbert Wigwe, Mrs. Shola David Bora, and other private sector leaders in Nigeria, seeks to mobilize the private sector to leverage the private sector's collective capabilities, expertise, and resources to support government in accelerating improvement in health outcomes through innovation and partnerships.
How important is innovation in improving public healthcare delivery in Nigeria?
The state of the health sector in Nigeria is characterized by suboptimal health outcomes, poor quality of care, and lack of protection from financial risk. Despite significant investments in the health sector, we have not seen the commensurate results in terms of health outcomes. So if you like, despite multiple approaches to advance health outcomes, we're not really seeing that move the needle in terms of the current low-level equilibrium in our health system. So in a sense, the current health programs are inadequate and necessitate a bold, disruptive, and innovative approach to move the needle and raise the low-level equilibrium when it comes to health outcomes. Many other African countries have been able to meet their health goals by spurring thousands of innovations. In Ethiopia, for example, policy and technology innovations were able to ensure that over 30,000 health workers were at the front lines to deliver maternal and child health services. In Malawi, the use of mobile technology and apps were used to undertake performance management measures that ensured that MDGs 4 was achieved in record time. In Nigeria, there is limited harnessing of technology and innovation in our healthcare delivery system.
Now, what areas in Nigeria's healthcare space requires greater private sector participation?
The private sector is a rich source of innovation, right, that the health sector can benefit from and indeed adopt. We know very well about the efficiency gains and approach of the private sector. We know that the private sector has supply chain capabilities that can help the health sector in reducing stock-out rates, for example. We know that the private sector has superior marketing capabilities that can help to address some of the demand creation issues that we have in the health sector. And that is why the Private Sector Health Alliance is very excited that we have reached a phase where we have identified 42 promising innovations here today who went through a business development bootcamp to shape their aspirations, enhance their business and financial capabilities, and build some of their technical skills to support them in contributing to the Saving 1 Million Lives movement.
Now, what do you hope to achieve with the bootcamp?
With the recently launched Health Innovation Marketplace by the Private Sector Health Alliance, we seek to do three things. First, we seek to identify, showcase, and nurture promising health innovations that address our biggest healthcare challenges and catalyze improvement in health outcomes. Secondly, we seek to support or ensure that there is accelerator support and market linkages for our promising innovations to ensure that they achieve market readiness and scale. Thirdly, we seek to build a convergence platform around health innovation and connect all the actors within the health innovation marketplace. And finally, we seek to make targeted investments in selected innovations to support them during their scale-up phase for catalytic impact.
What sort of innovation do you look forward to seeing today, or rather, what kind of innovation do you look forward to winning at the end of the day?
I think it is interesting that 4 archetypes of innovations have emerged. The first is really around technology networks. There are several ICT, mobile health, and app developers here today who have created technology support systems to make sure certain data is collected and the performance management at the front line happens. The second aspect is that we're seeing a lot of franchising and innovations in service delivery to support this movement to save 1 million lives. The third is really the manufacturing aspect. the manufacturing of essential life-saving commodities, particularly around nutrition. There are several innovators here that are local producers of nutritious commodities that can help to save lives. We know, of course, that nearly 50% of our children under 5s in Nigeria die as a result of malnutrition-related deaths. So we know that supporting these kinds of local producers will play a role in not just saving lives, but also creating jobs for our health sector. And I think the last archetype is product specialization. There are several point-of-care diagnostic tools, innovative medical equipment for this context, right? Resourced, constrained settings like Nigeria.
Now, what do you hope these innovations will achieve at the end of the day?
The first is to ensure that our innovations actually address an identified problem. And so we had to incorporate a unique public-private partnership where the government develops the problem statements and the private sector health alliance provides a platform for entrepreneurs, private sector companies, and organizations to collaborate to create the solutions for our biggest healthcare challenges. The second aspect is to make sure our innovations are context-specific and adaptable. Nigeria is a very different market from many other African countries, and we have to ensure that the replicability occurs in a manner that we can track results in terms of outcomes. And then the final aspect is to make sure that our innovations are sustainable. We want to ensure that we play a role in moving the health sector from being an economic drag to one that is a net contributor of economic growth and job creation whilst we save lives. This is a very unique platform, and I would like to use this opportunity to call on other private sector companies to join the likes of Dangote Group, Access Bank, Etisalat, and other private sector companies to provide a platform and support innovators in health to achieve our goal of saving 1 million lives every year.
Dr. Muntaqa Umar-Sadiq is the CEO of Private Sector Health Alliance.